Nigel referred to healthcare. A few points I want to mention there is that it's government responsibility to provide a high quality of healthcare for all. Unfortunately, the state of healthcare is very poor, to say the least. We lack specialists, especially in the rural areas, as we went to Saudi. And so you don't have a specialist visiting. You don't have the proper equipment. They don't have a scanner or a CT scanner. They have to come to Georgetown. They don't have training facilities for nurses and medical professionals. All rural hospital, what we will do is that we will revisit that specialty hospital, but it will be private sector oriented, no government money in it. Whatever fiscal incentives are required to make it efficient and functioning on a world-class, with world-class quality, we will encourage the investor to do that. Secondly, we will reorganize Georgetown Hospital. You know the state of the hospital. And every time they get a little grant from IDB, then they build a wing, right? And when I visited the male wing the other day, there's very little ventilation. There's no air condition. It's just a box. You know, I had to ask a friend of mine who went with me to go and buy a fan for the person that we were seeing, right? It's so bad. So you get a little grant, and then you build a box, right? But then you raise the budget for healthcare from 21 billion to 35 billion. We need in this country, whatever money we're spending, it must come from budgetary allocation rather than these grants that impose a lot of restrictions that we don't need, a lot of professional services that we have to pay to foreigners. We have to do things on a holistic way so that it generates the outcome. We have to get professionals to handle it, not people who never run a cake shop. You know, professionals must run it, right? They must build it. It must have the best in the industry. That's the way I do things here. I use the best in the industry, right? And people want to know why I'm successful. Then they say it's concessions. Yeah? And then they say I'm a hustler. Well, I'm proud to be a hustler. I've been a hustler all my life. All Guyanese are hustlers. They have to hustle to make ends meet, to pay the bills, to pay loan. You know, they are the only one who don't hustle. They start the day with a little coffee. Then they come in and they give a little interview. Then another appointment comes. They put on the jacket and they go and take a photograph. That's not our style. You know, I've been a hustler all my life. We will restructure the national procurement of drugs and weed out the corruption that exists there. There are various means. I was a former auditor. Right? There are various means you can do, and it's easy. And every year the auditor's report, the state audit report comes out and lists a number of loopholes and problems within the financial administration at the Georgetown Hospital and the procurement of drugs. Drugs are imported sometime when it comes. The storage conditions are bad. Sometimes it's expired. Remember when people on the West Coast say they receive expired drugs? It's real, right? I mean, the failure of leadership at all levels is appalling. And our problem is the failure of leadership. But there's where they want to make the system tight, that it must be a ministerial discretion so that you can go to them, so they keep you in line, you know? And that laid a fertile foundation for corruption. We have a corrupt state. And I'll show you the extent, if we didn't have this corrupt state, what we could have done. Now, as